We used to think of OCD as having to do with your childhood and had to do with like your relationship with potty training, for example. That's where that phrase anal, you're a very anal person, comes from. And what we realized in the 90s through MRI studies is that ultimately this is a brain abnormality. I also think that there's a misnomer and that we often think of OCD people as being perfectionistic, which is really only one type of OCD. Many of my patients are chronically late, are imperfect. They can't start projects because they know they're going to take so long. We can sometimes see people who actually appear very disorganized on the outside, in addition to what we would classically think of as like a type A personality. I think my favorite part of my job and why I'm so passionate about this is the ability to destigmatize OCD. When you tell patients that this is the third time I've heard this intrusive thought this month, you can just see the relief come across so many patients' faces and they can just relax. And I actually believe truly that that is 50% of the treatment, just that they are able to understand what is going on with them, why it's going on with them, and that there's something we can do about it. Exposure response prevention is one of the most effective psychotherapies for anything that we have. And it is one of the only psychotherapies where we use a behavioral treatment to directly change a brain abnormality. So, exposure response prevention involves a lot of bravery, a lot of courage. We really spend a lot of time making sure people are ready to do this work before we start with it. And what it involves is what the person is afraid of. We, in a very slow and systemic way, expose them to those fears. So the classic example, the person is very afraid of touching things because they don't want to get germs on their hand. Well, we will very slowly practice touching things. And patients will start by touching simple things like they might touch my mouse of my computer, they might touch my keyboard, they may touch my keys, they may touch the doorknob on my office door. And we will then move on to scarier things like maybe touching a bathroom door. A really common one in our clinic is touching the elevator button. One of the incredible things about telehealth is that we can kind of take therapy on the road, meaning that people can do the exposure work with me at their house where they're actually experiencing the compulsions, which is something that was brand new post-pandemic. And it has been just a revolution, I think, in exposure response prevention world. And the incredible thing is, unlike traditional psychoanalysis that takes years and years of therapy, we often see results in as little as 3 to 8 sessions. The behavior itself changes the thought process. And that's what makes it so incredibly powerful.